Welcome all. Welcome to this M Excellence presentation. And here this particular presentation is not related to one particular MCQ examination or in any competitive examination, upcoming competitive examination. But recent spate of events actually propelled me to post this particular data because this is very important because WHO already have declared that corona as a pandemic. Coronavirus infection and deaths, and the cases are event have been termed as a pandemic event that we all know. And I have got that in particular information just today. There's one person have died in India. So he was 76 years old. Most importantly, he was 76 years old person who have died. So right now you don't know what other issues he was facing. You don't know is he having a restrictive lung disease already on that person, whether the person is diabetic or the person is hypertensive, having any arrhythmia issues or any past stroke events that you are not aware, but is termed as the first death in India by all the news media. And you see what is actually happening. All the malls, all the schools are closed right now. It is the whole India as if it is coming to standstill. All are scared at this point of time, and more than coronavirus pandemic, seems there is a nihilistic delusion that is propelling all around. Everybody seems scared, everybody seems so knowledgeable, everybody is talking about coronavirus. Who doesn't know anything about a virus, whether it's RNA virus or DNA virus? You ask them what is this particular virus, what are the other viruses are available, they will give you the information that you yourself will be surprised to see. They don't know what is coronavirus, they don't know what is dengue virus, they don't know the fatality related with the dengue virus, they don't know what is the Nipah virus. So these are the important issues they are not at all aware. Only by seeing and sensing the changes and whatever published in the media that is being given there, they have not checked the facts that have been actually put on the web and also in the papers, and they cannot and they are not willing, just passing the information like sharing in the WhatsApp and the groups of the WhatsApp group or Telegram group. These people are going bizarre, and it is like a nihilistic delusion. This world is coming to an end, and that is actually propelling all around, and surprisingly it is seen in the people who are educated also. Even among few doctors are also sharing it. I've seen it. Those persons who are practicing doctors, those persons who are studying, you are educated person. Once you are educated, it is your responsibility to be vigilant, to cross-check the information that is circulating in the media. It's not an Android smartphone, it is not a Oppo phone or a Apple phone or a OnePlus phone that you are checking what is the RAM and what is the software is involved in it. Even once this is about one life, and this is if you are scaring to the people to the death, then it is going to harm you more than the death itself. And you see the first quarter death rate in AIIMS in January to this is the first quarter death rate. So January to March 31st, the death rate, there is total 57 inpatient department. It is from the inpatient department, and 57 death have been already. You can check it in the cross check in the AIIMS website. Whatever information we are actually giving from the authentic websites. So you can cross check also all the data that I'm giving. So there's a 57 death from the AIIMS in 90 days. So just one death in India actually scaring people to the absolute level. They gone bizarre. They are thinking, they are not looking at people, they are not going to the malls, they are not going to the seeing the movies. They are really scared and they don't know what to do. And actually this sort of nihilism is going to worsen if you have already a disease condition. If you have a heart disease or if you have any other disease condition that you are non-communicable disease that you are having, then it is going to worsen it much more. So you should be cautious. Okay, this is a virus and which is spreading, you know the how it is spreading. So these are the, you have to take the precautions, that is sure, that has to be done, but it is not going to end the life of yours just by thinking this way or being so very scared. And cross check whatever the information that is circulating in the media, you should cross check it. And also request to the people who are circulating the things in the media, you sense one to few things which are very important. Number one, yes, it is having a fatality, but do you know what is the fatality? What is the how many person died in India in the 2019? It is roughly 7.2 per thousand population. So considering India is 100, we just considering 135 crore almost today. So it is roughly 7.2 into 135 lakhs. Do your multiplication, you can find it out. So roughly there is 1 crore, almost 1 crore death. It is a 95 to 1 crore death in 1 year in India. So roughly there are chances that there will be 3000 deaths, so per day. So that is the rough chances that you have. So if you see this particular chance number, so you can understand how minuscule is the one corona death and what is the fatality rate of this particular infection. Obviously you need to stay cautious, you need to stay guarded, but you should not think that world is going to be an end. It's not an Hollywood movie, it is not going to endanger the species altogether. But if you are scared to scared to health, then you are worsening the situation for yourself. Be cautious, take precautions, be aware, and then after make informed and responsible approach to control this particular infection, to minimize its spread. Take all the measures that are actually prescribed by doctor, and then after you be concerned. Obviously you should be concerned about the infection and try to minimize the infection, but don't be scared that this is not going to actually extinct the human race. And also remember one thing, when most of the people are running away from the social gathering and all, this particular patients, and not only coronavirus patient, there are adenovirus cases, there are influenza cases, there are dengue cases. They are coming to hospital. They are coming to hospitals, and there are doctors, nurses, and the healthcare worker who are seeing these patients. They are the persons who are braving, and they are not scared. They are totally aware of the situations, and they are facing it head on. So this is the sort of responsibility a doctor do have for the society. So we request you to don't portray doctor as a villain. Don't try to manhandle them at will. Patient will die. Obviously, patient is coming with a pathology. There are chances a patient, after best treatment procedure, best treatment with proper protocol, then also patient can die. But seeing a 76-year-old death after a infection without being aware of any concomitant disease that person is also having, and if you are behaving in this manner, you are making the situation worse for yourself. So be responsible and take your decision. I hope this address to the public will actually help you to understand the role the doctor is playing, and to treat a patient, and what are the risk factor actually he exposed himself to, which most of the public are going to run away from. And I request and I hope the public is going to recognize this role of doctors and value them. Thank you.